Thank you for joining us. We are coming to you live from the Emergency Operations Center here in Centennial. First, just moments ago, we've heard that there was a shooting outside of Hinckley High School in Aurora. 2 people were transported to the hospital. They are in our thoughts and our prayers. And we, of course, as a state, need to redouble our efforts to reduce youth violence and improve public safety. We've proposed $115 million in the state budget for improving public safety, recruiting and retaining law enforcement, co-responders, meeting behavioral health needs, reducing recidivism, community policing, and really making sure that across Colorado, no matter where you live, you can be safe in your home or safe in a park outside of a high school. In particular, with the 2 shootings in Aurora, we are going to have a renewed focus on reducing youth violence. And we'll look forward to learning more about that in the hours and days ahead. But now, as a state, we pray for the recovery of the 2 individuals who were transported to the hospital. This is the room in the Emergency Operations Center where we held many of our early COVID press conferences. The first press conference we held here was March 22nd, during the early weeks and months of the pandemic. Just to put things in perspective, at that time, we had only 600 cases that we knew about. There were probably more, but remember, there was hardly any testing available in those first few months. We had about 60 people hospitalized. We'd only lost 6 people to the deadly virus back on March 22nd when I went before the state of Colorado here at the Emergency Operations Center. With erratic leadership from the federal government, Colorado was largely on our own to compete with other states, with other countries for critical testing supplies, PPE for our frontline healthcare workers, ventilators to save as many lives as possible. It was a mad dash to keep Coloradans safe, to answer questions with new information emerging daily about the threat of the deadly virus, and to have the supplies that we needed to keep our hospitals open and serving people, both those with COVID and those who had heart attacks or strokes or were in need of emergency medical treatments during those early days of the pandemic. Fast forward to today, we have now lost over 9,000 of our fellow Coloradans to the pandemic. And we can be proud that that ranks us 9th lowest per capita deaths of any state. But that's hardly a consolation to the friends and family left behind, sisters and brothers, mothers and fathers, friends, those that we've lost along the way, or that faced harrowing ordeals in hospitals for weeks or even months and are now recovering their health. We, at the time, in the early chaos, battled for kits, for swabs, for reagents to run tests, for masks, for gowns, for equipment. Back then, a life-saving vaccine was really something that we could only dream of and hope for. And thanks to the triumph of modern science, the expeditious testing work and review work to confirm the vaccine was safe and effective, a vaccine has been rapidly made available and deployed. Today, more than 81% of adults in Colorado, more than 37% of 5 to 17-year-olds have gotten at least 1 dose of the vaccine. And I'm proud of how far Colorado's come and how far our nation's come. And we won't stop until this turns from a pandemic to an endemic. It's not going to go away. And we look forward to the day when we can put the worst that the virus has to attack us with behind us, with better treatments, higher vaccination rates, a lot more on the way. I just got to visit and thank the men and women at the Emergency Operations Center upstairs, among them the Fusion Group. And I briefly joined them in their discussion, got briefed on what they're working on. Very tangibly, they're working on delivering the 500 additional hospital beds within now about 20 days that we committed to about a week ago to make sure that we can meet the needs of Coloradans and needs of hospitalization. And they're working on rapidly expanding monoclonal antibody treatment. I was just struck by how much more tangible and precise these were than the early deliberations last March, last April, where literally we couldn't get swabs, we couldn't get reagents, our hospitals were out of gowns and gloves and masks. Now we're at a point where we know what we're facing. We don't know every part of the virus intimately. We're still learning more, but we have a much better sense from a medical and scientific perspective what we're facing. We know how to reduce deaths. We know how to make people have a high degree of immunity. And we have a very deliverable plan to increase hospital beds and substantially increase administration of monoclonal antibodies. It's just a very big sea change from the panic of the early days when nothing was in place for our country, the United States of America, one of the wealthiest countries on the face of the earth, to face a pandemic. And I hope that as this pandemic recedes, and it will, that our nation will be better prepared should this happen again. And unfortunately, I would say when this happens again, and we hope it's not in our lifetime, but it certainly could be. Right now in Colorado, we're facing one of the toughest waves that we have since the pandemic begun. And that's another reason I wanted to brief the people of Colorado from the Emergency Operations Center to know that this is still an emergency and pandemic situation in Colorado. People have asked, is the pandemic over? The answer is, with 1,500 people hospitalized from COVID in Colorado, representing approximately 20% of our total hospital capacity in the state, it is still a pandemic. It doesn't mean that there won't be people hospitalized a year from now and 10 years from now from COVID-19, just as there are for many other conditions. But when a single diagnosis reaches 20% of your total hospital beds, that is very much a pandemic, and Colorado is very much at a height of that. We have a high level of spread in across the Mountain West and the upper Midwest. About 1 in every 38 unvaccinated Coloradans are currently contagious with coronavirus, and about 1 of 62 Coloradans as a whole are infected with COVID-19. And we are addressing our hospital capacity issues by extraordinary measures, including expanding by 500 beds to provide that safety margin if things get worse rather than better. On that note, as where we are today, Colorado as a whole has had a total of 804,734 cases, including me, including Marlon, as two of those, including many of you that may be watching this. And of course, I would add that we fully expected there have been hundreds of thousands of cases that were not confirmed by tests, especially in those early days. I would also encourage everybody who might have had COVID, as I did, to get vaccinated. The hybrid immunity, meaning if you had COVID and you're vaccinated, is the highest form of immunity that you can have. And the protection from an infection, the natural immunity, there's a lot of lack of information about how long and enduring that is. So especially if you had COVID in the first 6 months or a year, it is very important to get vaccinated to get an even higher level of protection for yourself, for your family. You've been there, you've had it, you don't want to have it again, you can avoid it. 1,518 people hospitalized in Colorado from COVID right now. That's 17 fewer than yesterday. The numbers go up, they go down. They've still been trending up on a week-to-week basis. I'm grateful that we have a day where they've decreased by 17. Of those 1,518 hospitalizations, only 274 are people who are vaccinated. 1,244 are unvaccinated. So we have it in our power to end this pandemic now if everybody was vaccinated. And look, you can't get everybody to agree on anything. Let's call it 97%. If we get 96, 97% vaccinated, we wouldn't be here at the Emergency Operations Center. There'd still be 200, 300, maybe 400 people in our hospitals with COVID getting treatment, but not 1,518, because 1,244 of them come from that 19 or 20% of the population that isn't vaccinated. If you're out there and you've, looked into the vaccine and for whatever reason decided not to get it, I really urge you to reconsider, to just look at the data, the real data, the CDC, the scientific studies, data out of every other country, data out of Colorado. It's a very simple step you can take to protect yourselves. There's no one hospitalized in Colorado from side effects from the vaccine right now. Zero. Have there been a few people that had to go in for a day? There have. But we have 1,518 people hospitalized from COVID right now. And if What I'm worried about is if you don't protect yourself and get vaccinated, you could very well be one of those in short order with the prevalence of the virus in our state. And while we hope you make it out, and most people who are hospitalized will make it out, not everyone does. Not everyone does. And for those who do make it out, it's still very harrowing to spend days or weeks in a hospital, not knowing if you'll get better. Many people have a long road to recovery. Get vaccinated. Along those lines, also important that people who got vaccinated 6 months ago get their booster. The FDA has followed what Colorado has done and should be available for every adult 18 and up. And it is very important. We didn't know at the time. Nobody knew how long the immunity would last, and we knew that it looked promising. The studies have showed a significant waning in immunity after 6 months. Still protects you, not as well. Get the booster. And there's still a question mark on that too in terms of how long this lasts. We hope, in the best case scenario, is it's like the DTaP vaccine your kids got and you got and other vaccines where you get 3 and you might have 10 years or even a lifetime of protection. It's also possible that a year from now or 2 years from now, there might be additional booster doses that are needed. Only time will tell as we learn more about how to defeat the worst the deadly virus has to attack us with. There are currently 11 kids, 0 to 11, in the hospital in Colorado. There are 9 kids that are 12 to 17 in the hospital. And this is also important to note, and this has been the case for weeks now. Of the 9 kids that are 12 to 17 who are hospitalized, 0 are vaccinated. That's right. About half of our 12 to 17-year-olds are vaccinated in the state, and we haven't had a single one for many weeks who's been hospitalized. The vaccine is effectively very close to 100% effective at preventing kids from getting very sick from COVID. That is, wish it was 100% for people of all ages. As you know, there are still people in their 60s, 70s, 80s, those who are immunocompromised who can get very sick even though they're vaccinated. They're a lot more likely to pull through, a lot less likely to get COVID. But it's not the same 100% protection that our 12 to 17-year-olds have. We haven't lost a single person under the age of 40 who's been vaccinated since this Delta variant has hit Colorado, since early summer. And we've lost several dozen who've been unvaccinated under 40. We've lost 9,120 people to COVID. Again, while that means that we are in the bottom 10 states, lowest 10 states for deaths per capita, which means Coloradans by and large have handled this well, that is not a consolation. It doesn't bring back the 2 friends I've lost to this. It doesn't bring back anybody who's experienced loss in this horrific pandemic. We know this wave will end, but we are not going to wait idly until it does. We're working around the clock to expand monoclonal antibody treatment, to expand our hospital capacity, and to encourage Coloradans in every way possible to get vaccinated. And after 6 months after your first 2, please get boosted. Boosters offer us significantly more protection against the deadly virus. And if you get boosted now, you'll be protected in time for the holiday season, for Christmas, for New Year's. To expand the use of boosters and get more Coloradans protection, we signed an executive order declaring just the simple facts on the ground: Colorado's high risk. And that made every adult who 6 months ago got Pfizer or Moderna, or 2 months ago got Johnson & Johnson, eligible for the booster. If that is you, you should get it to get that increased level of protection. I'm thrilled to see the FDA following that lead, along with a number of other states that followed our lead: New Mexico, Arizona, West Virginia, New Jersey, and New York. Now, we've heard that there's still incidences of Coloradans who are eligible for the booster that have had trouble getting it or being turned away. There's many more stories of people who went in with no problem and got the booster. But earlier this week, in response to that, CDPHE sent a letter to providers directing them to immediately remove barriers to the booster. Do not ask questions, just administer it. I also spoke personally to the general counsel of several major pharmacy chains that we had reported issues with in Colorado. And we got the commitment of their corporate and legal departments to further clarify to their management in Colorado that nobody should be denied the booster per our state guidance. We're even more confident that after the FDA acts and CDC acts, all of those barriers will disappear altogether. But I would add that those are more the exception than the norm. And the vast majority of Coloradans who've simply gone to a pharmacy or a clinic have gotten the booster with no issues whatsoever. About 31% of Coloradans who got vaccinated 6 months or more ago have gotten their boosters. And frankly, that needs to be higher. Really, everybody, regardless of your age, who got the vaccine 6 months or more ago, should get boosted and make the plan to do that, whether it's tomorrow, whether it's next weekend. There's ample opportunities to do it with our mobile vaccination stations, your local clinic, your local hospital, your local doctor, your local pharmacy. Thanksgiving dinner will be a lot more enjoyable with additional protection. And while that protection and from the boost won't be necessarily complete by Thanksgiving, you'll certainly have some degree of increased protection from that if you get that immediately. If you visit comassvax.org and search Coors Field, you can find an appointment this weekend. I'm going to be popping by there tomorrow. If you have a 6-year-old and a 5-year-old, they get the kids dose. Parents can get the booster. Grandparents, aunts, and uncles can get boosters. We want to thank the Colorado Rockies for partnering with us to host the vaccination clinic for first doses, second doses, boosters, and also flu shots. We will help protect you from everything we can protect you from in conjunction with the Rockies. And Dinger's going to be there too, who I understand is fully vaccinated and is happy to entertain kids while they get protected as well. They're also going to be giving away jerseys and baseball cards and hats. Visit comassvax.org and search for Coors Field to find an available appointment. You'll also see a number of other events listed there. If you're wondering where to find a vaccine, you can simply visit covid19.colorado.gov/vaccine or call our toll-free number, 877-268-2926. Once again, call 877-268-2926. Whether you're wondering whether you can get the vaccination for your kids, whether you're wondering whether you can get your booster, they will connect you with the opportunity to do that within the next few days. The other strategy that we are pursuing to have an immediate impact on hospitalizations is significant expansion of monoclonal antibody treatment. Last week, we were joined by Jill Lester, a recipient of monoclonal antibody treatment, who spoke about her experience recovering from COVID successfully with help of monoclonal antibodies, which can reduce your chance of hospitalization by about 70% if it's administered early in the course of infection. When we succeed in implementing increased use of monoclonal antibodies, it will reduce the strain on our hospitals and significantly reduce the likelihood that Colorado will breach hospital capacity. To break down barriers further for Coloradans who benefit from monoclonal treatment, we plan in the next 24 hours to issue a standing order that allows Coloradans who qualify to refer themselves to treatment. Previously, monoclonal antibody treatment needed to be referred from a doctor, but that is an impediment to many people being able to access that treatment. If you recall, when quantities were limited early in the pandemic, you couldn't even get a test without a referral from a doctor because there were hardly any tests in Colorado. Of course, tests are widely available. You can get them in your home for free from the state. You can go to covid19.colorado.gov and sign up for the testing delivered to your house program. There's also many sites across the state that offer testing. But very soon, you will no longer need a referral or have additional burdensome restrictions for access to monoclonal antibodies. They are for you if it's in the first week or so of your infection, but it's too late once you're hospitalized. Monoclonal is not what they give you. They might give you steroidal and other treatments, but none of them are nearly as effective as monoclonal antibodies. So once you're diagnosed and you're a higher risk individual, meaning anybody, of course, 60s, 70s, 80s, but it could be a 52-year-old with moderate asthma, 56-year-old with diabetes, also very good candidates for monoclonal antibody treatment. Any Coloradan with a positive test beginning on Monday can dial 800-268-2926 to determine if they're eligible for monoclonal treatment and sign up for it. To get the latest on this, covid19.colorado.gov/monoclonal. And we're looking forward to continuing to expand that to reduce hospitalizations, reduce deaths, and make sure that more Coloradans have access to the very best treatment that we have and removing any of the impediments along the way. But monoclonal antibody treatment is only as good as people knowing that they're positive before they're in need of hospitalization, which means that testing is absolutely critical as well. I encourage anybody who has any symptoms, cold or flu-like symptoms, fever, headaches, chills, get tested. I encourage Coloradans, anybody visiting our state for the holidays, to utilize the free testing locations across the state to make that easy. To find a testing site near you, you can go to covid19.colorado.gov/testing. Testing can give everyone you're celebrating with a greater peace of mind that the only thing you're passing around the table is the turkey on Thanksgiving, not a deadly virus. We also continue to make free COVID-19 testing available to all Coloradans for home delivery. Those Binax tests are intended to be used regularly. They're not designed to be used to diagnose illness, but you can certainly use those to screen your family before visiting grandma for extra security. The people of Colorado should know that this wave won't last forever. We won't always be at the Emergency Operations Center dealing with a pandemic. We'll be here again for fires, for floods. We hope not, knock on wood, for another pandemic. But it's important that people know that we're still here now, we're still staffed now, and the people of Colorado need to treat this like the public health emergency it is and continue to wear masks around others indoors, avoid socializing in large groups whenever possible, and most importantly, get protected, get vaccinated. It's a simple thing you can do to turn the tide of the pandemic. And if you've been vaccinated and it's been 6 months, get that additional booster shot. Lastly, while during this particular period, I want to make sure that people are careful over Thanksgiving and the holiday season. During your travels, wherever you go, incorporate testing, incorporate mask wearing. If you're in indoor areas with others, it's required in FAA and most of those airport facilities. But don't just do it because it's required and do the minimal that you could get away with. Do it because you care about not bringing that virus back to Colorado and protecting your friend and family. This holiday season is a time when people will gather indoors with our friends and family. It's what we do. We love one another. Many people forwent and didn't gather with their loved ones last year because there was no vaccine. We now have highly effective vaccines, boosters that are available. You have time to get protected before Christmas. Please take advantage of that. Not only do you protect yourself, and first and foremost, I think that's what drives most people to get that booster and get protected, but you also will help end this pandemic and the emergency. With that, happy to take some questions.
Governor, back in July, you declared that the health emergency is over and you started rolling back some of the pandemic restrictions. Given now that it seems like people really aren't paying attention or don't understand, I guess, the gravity of the situation, was that premature? And also, I wonder how you kind of communicate to people the gravity of the situation, the notice that they need to take, since they were told, they could start letting their guard down.
Yeah, well, and the truth is, it went from a very simple public health emergency when there was no vaccine last December. We had very rudimentary tools. We had to avoid seeing others, and we had to wear masks. The truth of the matter is that if everybody is vaccinated, those kinds of gatherings are much lower risk now. Now, you want to make sure that folks are boosted, and particularly the elder members of the family have all gotten their third shot because the immunity wanes faster for those in their 60s and 70s and 80s. But it's a fundamentally different situation. We have 1,500 people in our hospital, which is at a very high level, but 1,300 of them, as we talked about, are unvaccinated. The crisis on the public health side is mostly among the unvaccinated, and the patience of those who are vaccinated is rightfully wearing thin with regard to additional inconveniences that they have to endure simply because there's a 20% or so of our fellow Coloradans who haven't yet made the decision to protect themselves. And it's frustrating for many families because, families are diverse, and many families have a member or two that for whatever reason won't talk about it or hasn't gotten the vaccine or won't acknowledge whether they got it for whatever reason. And that can be very frustrating because we all love those family members. We all love those friends. And sometimes it just seems like a mystery why they don't seem to love themselves enough to avail themselves of that level of protection. One thing is clear, you don't win people over. You can win people over with honey more than vinegar. And I think it's important to not be in their face in a hostile way, but to simply say, here's the data, here's the facts, emailing studies that have been done, articles that have been done, being able to engage in a constructive discussion with folks about what their hesitation might be. It could be as simple as a fear of a needle. And you know what? I tell people who are scared of needles, I say, you know what? If you get COVID in your hospital, you're on the IV, you're going to have a couple needles that are stuck in you for weeks, not just a little one for a second. So if your goal is to avoid, being pricked in needles, that small prick today can prevent days or weeks of being pricked by an even larger needle in the future. People should take the steps they need to protect themselves. In addition to being vaccinated, it is the decent thing to do to show we love one another, to wear masks around others in crowded indoor areas. Even if those who should be taking the most precautions and aren't yet vaccinated aren't, we can help protect them because we love them as our brothers and sisters. We hope they take the steps to protect themselves. But in the meantime, it can affect all of us when our hospital capacity is exceeded. While our hospitals are serving everybody now with immediate health needs, there already are elective procedures in the state being delayed. Not a halt to elective procedures. There's still people that are able to get the back or knee surgery that they need, but they're being done at a slower rate than normal because of the large hospitalizations, both from COVID and from other conditions. But about the surges from COVID, when we say 20% of the hospitalizations are from COVID, the reason that's a crisis level is we normally run hospitals at 75, 80% capacity. They're not there to be at a quarter capacity. They're built at 75, 80%. So on top of that normal load, you add 20%, suddenly you're close to 100%. And we're at, 92% or something, 93% right now. And that's why the monoclonal antibody treatments, and Colorado's taking this seriously, are very important steps. So it's a different kind of public health issue than it was. A lot less known early on, a lot of chaos, very difficult to plan. Now there's a plan. People in Colorado should know what they face. They know the risks. They know the steps they need to take to protect themselves. And we just need to work to get more Coloradans to take those steps.
Governor Polis, Sarah Flower with KSUT Four Corners Public Radio. Curious about the monoclonal antibody treatment with hospitalization so high and projected to reach beyond 2020 levels. When are we going to see the successes of the mobile units being rolling out and hospitalizations declining due to the treatments?
Yeah. So to be clear, we've been administering, and hospitals have been administering monoclonal antibodies for months in Colorado. What we are doing now is a surge in monoclonal access. So we're saying the regular healthcare system isn't doing enough. So first of all, we've challenged our major providers to step up, and they are, and they have. UC Health, Kaiser, all making commitments on increasing the monoclonal antibody therapy. In addition, the state has added mobile units to further develop those, and we're working with other clinics and freestanding facilities to further surge monoclonal antibody treatments to folks. So there would be more people in the hospital today if it wasn't for monoclonal antibody treatment. And we expect that difference to grow even larger in the weeks ahead as we surge the monoclonal antibody treatment to make it more widely available in Colorado. I would add that this is because we finally have increased supply from the federal government. The supply had been very limited over the summer and over the fall.
Hi, Governor Polis. It's Jason Grenauer from Denver 7. It's pretty clear that a majority of the unvaccinated in our state won't get vaccinated simply because they're being asked to. The state's been asking them to do so for months. So what will it take for the state to put mask mandates or rules in place to stop or slow the spread?
Well, what I feel that I've asked and tried to present the data every way I can to show people the vast benefits of getting immunized. I mean, we're not even talking some kind of close judgment call where the benefits, barely outweigh the risks. I mean, we're talking exponentially increases in your safety and reduced risk by getting vaccinated. And now, yes, by getting the booster after 6 months. I'm hoping that's also a discussion that people have with their medical providers. If you're still out there and have any doubts about the vaccine, talk to your family doctor, talk to the nurse that you work with, talk to your healthcare provider, and family members. Engage one another civilly, with respect, with good information to try to break the hold that false information has on too many Coloradans. I think it's important that we view our fellow Coloradans that haven't been vaccinated not as malicious people. There are our friends, our brothers, our sisters, but rather as folks who have been victimized by false information. There might be, a small number. As I said, you're never going to get 100%. There's a small people who honestly and authentically have religious objections or moral objections to vaccines. That could be, 2-3% of the population, maybe 4, but nothing like the 20% that hasn't received this vaccine. And so for those who have received other vaccines in the past, I think it's important that they know that this vaccine will benefit them more than any of the other vaccines they've ever gotten throughout their whole life. I mean, those are important. You don't want to get tetanus, but those are all of much lower incidence, mumps, than COVID right now. If you don't get vaccinated, you're probably going to get COVID. Almost everybody will. And some folks who are vaccinated are going to get COVID, and they'll have much more minor cases. So that's the way we end this pandemic. In the meantime, we certainly want to expand our human decency and our love for one another and show that, by wearing masks around others out of respect, out of love, especially to protect those who haven't yet made the decision to protect themselves. But of course, people who are unvaccinated need to know that can't occur forever, even though there's still a lot of mask wearing. In the county I live in, it's required. And in other areas, it's just a neighborly thing to do. That isn't going to occur forever. And we want everybody to be protected. And the best way and simplest way to do that is to get vaccinated.
If I can follow up,
Go
you
ahead.
mentioned people who were vaccinated that are going to get COVID. What do you say to those people who did their part, they got their vaccine, but now they have to worry about breakthrough cases because this pandemic isn't going away, because people aren't getting the shot?
Yeah. So if you've been fully vaccinated and you're young, middle-aged, and reasonably healthy, your risk is much, much, much lower than it was last December. You still don't want to get COVID. It's no fun to be sick for a few days. But just to point out the statistics and put an exclamation point on it, since July and the Delta wave, 0 vaccinated people under 40 have died. 31 unvaccinated people under 40 have died. Over 150 people aged 40 to 60 have died. Over 150, I think it's 160 or 170. Only something like 15 vaccinated people between the ages of 40 and 60 have died. So an exponential reduction in risk. Is it more risk than life was in 2017 or 2018? Yeah, it's higher risk, even if you're vaccinated. But it's not so far outside the bounds of normal risk that informed Coloradans should have the right to take, that it would call for any additional steps that would in any way impinge on people's freedom to make these decisions for themselves.
Hi, Governor Dave Perry with Sentinel, Colorado. At least one metro area health department is considering new COVID-19 requirements. To be clear, do you support local county health department efforts to impose mask and proof of vaccine requirements, just not on a state level?
Yeah, we strongly support local governments taking the steps they need to protect members of their public. And that's a important discussion for local public health agencies to have. And I think as a state, we all understand that there are trade-offs and that people in different areas make different decisions. And that's appropriately done at the local level. There's been mask requirements in several Colorado counties for months. And there's been other Colorado counties that are very unlikely to enact mask requirements, and there's some that might enact additional requirements. I think it's important to make sure that local decision makers on the ground are making these calls. We live in a very divided time, Dave. I wish we didn't. But where we are now with the virus is in a place where people should be civil to one another, but understand that you can reach different conclusions based on the same data. If your county commissioners don't want to institute mask mandates, it doesn't mean that they want to kill anybody. It doesn't mean that they want more people to die. They don't. They simply are making the trade-off that at this point in the public health pandemic, with most people protected, it is no longer a proper role of the state to require you to wear something at a particular place at a particular time. In other areas, locally empowered decision makers are making the decision that, you know what, in our area, our values are such that we're willing to slightly restrict what people do for a period of weeks or months more to reduce the spread of the virus to those who are still unvaccinated, or perhaps to a few who are vaccinated but still among a vulnerable population. So I think that's a very reasonable way to do it. And I think that the motives of either side should not be called into question, Dave. Though, first of all, this is the easy one, of course. People who want you to wear masks and are requiring masks are not trying to restrict your freedom. They're not issuing that order with any joy. They don't expect that order to remain in place for a very long period of time. They're simply saying, in our community at this point in time where we are, we all need to show the decency to wear a mask and protect others. But so too, in communities that aren't making that decision, they are not saying that human life isn't worth protecting. They are not deliberately trying to spread the virus or kill people. They're simply saying, look, at this point, you've had your chance to protect yourself and get vaccinated. Is there still some risk if you're not? There's some risk, of course, but again, not outside of the normal risk that people have, higher perhaps, but not extreme. And at some level, it's a matter of personal responsibility. Our hospitals full of people who are unvaccinated, a matter of personal responsibility, of course, until it gets to the point where it affects everybody else. And it's right on that border right now. Some elective procedures delayed, some still occurring. That's why we're surging beds. It's why we're surging monoclonal. And of course, Dave, it's why we're very supportive of the paths that counties and areas of our state take to really meet people where they are and be honest and authentic about these trade-offs and make the decision that is responsive to the residents of that community.
Governor, if I can ask one question quickly about the monoclonal antibody treatment center. Is there a charge for those for someone to go? And if so, if you don't have insurance, what would it cost?
Do we have that, Maria? I think it's, we'll get that to you, Dave. I believe it's no charge, but, well, the buses are, but let me get back to you, because if you're a member of Kaiser or CU Health, I think it's through your insurer. But can we get back to you on that, Dave?
Thanks.
Yeah. It should not be out of pocket for the person is the bottom line, but we'll get back to you on the payer mix for that. Yeah.
Thanks, Governor.
Hi, Governor. Seth of the Gazette. Given the continued threat to hospital capacity, the rates of spread, and your role as the chief executive of the state, do you feel any responsibility for the situation we're in now? Thank you.
Well, this is, again, we have a plan to avoid overcrowding our hospitals. And so we've seen other states experience surges like Florida. We've seen them expand and surge monoclonal antibody treatment, and it has helped prevent hospitals from being overcrowded. We've always had monoclonals offered through our medical service, but we know we need to grow broader, we need to go bigger, and that's why we're taking bold action around expanding our hospital capacity, monoclonal treatments, leading the way on boosters. It is my hope that Colorado remains in the bottom 10 states for COVID deaths per capita, and we plan to take all the steps necessary to continue to protect our fellow Coloradans.
For the therapy, and then facilities can charge an administrative fee, and we're working on getting more free facilities to provide it.
So Dave, the buses are free, as I indicated. Some of the facilities, if you're not in their network or whatever, might have a charge. We're working on mitigating that, but the buses are fully free from the state, reimbursed by FEMA, fully available for folks who might not be part of a network where they can get it for free.
Hi, Governor. John Daly with Colorado Public Radio. I wanted to ask you about the crisis standards of care. How likely is it, do you think, that Colorado could have to enact that? And what signal would that send to its residents about the seriousness of the pandemic now, if that were to happen?
Well, Coloradans should already treat this very seriously right now. The staffing, the crisis of care standards around staffing have already been implemented. To be clear, that doesn't really change the practices in the hospitals. It simply, for their extraordinary work, shields them from additional liabilities for a period of time. With regards to hospital crises of care, we've laid out the additional steps that will be taken if we can't turn around this trend and rein in the pandemic. And yes, going to additional crisis of care around hospital treatment is one of those steps that, of course, no one would take with joy. It's not one our chief medical officer wants to take, but it's one that would be done before we would risk breaching our hospital capacity. That's one of the reasons that we continue to push the surge in monoclonal treatments, the additional 500 hospital beds, encouraging people to wear masks and avoid large indoor gatherings. These are the kinds of steps that can hopefully prevent additional crisis standards of care from being implemented. But of course, the state would stand ready to do that to avoid exceeding our hospital capacity.
Last question from the phone.
Hello, this is Meg Winker from the Denver Post. Question about the standing order for monoclonal antibodies. How are they going to verify if somebody, in fact, is high risk and qualifies? And if people who are not high risk just decide that they want this and refer themselves, is there enough capacity to treat them as well as the genuinely high risk people?
Yeah, so this will be rolled out in the next day or so, and you'll see the specifics of it. But we have the exact same, concerns that you articulated in designing the program. First of all, of course, demonstration that you have COVID needs to be done, and that you were diagnosed, that you were got it within 10 days per the CDC guidance. It's not effective later in the course of treatment, ideally in the first week. Secondly, there are very easily verifiable conditions that make you a good candidate for monoclonal antibody treatment, like age. Very simple to demonstrate that you're 65 or 75 or 82. And then the additional piece is around if you are younger than that, if you are under 60, how you show that you're at risk because of being immunocompromised or diabetic. And we did this before in the phased introduction of the vaccines when they were not available to every member of the general public. They were briefly available for those that had pre-existing conditions as well as those of different ages. When it comes down to it, a lot of it will be around self-attestation under penalty of perjuring yourself that in fact you are at a higher risk of COVID. It's the truth that we simply don't have, there's not enough supply of monoclonal antibodies to treat everybody who's diagnosed with COVID right now, nor is there a particular reason to give it to a 34-year-old who's been vaccinated who tests positive for COVID. I mean, there's just that person is not going to die and won't need hospitalization, and there's really very little reason to do that. But there is a big reason to give it to a 67-year-old who's unvaccinated, an 84-year-old who's vaccinated, more than 6 months ago and got it, a 56-year-old who's immunocompromised and a diabetic. And so those are the details that will be revealed the next week. Just one more point on that. The way it's done by and large now, by having a doctor in the middle and a clinic in the middle, disproportionately underserves communities that have a lesser degree of medical service. Those who are medically underserved have a much more difficult time accessing monoclonal antibody treatment if they don't just have a doctor that they can call to write them up for it. So neither system is perfect. We, of course, want to continue to trust that Colorado people are truly preserving monoclonal antibody treatment for who uses it the most. But the truth is we have more that we can supply, and we'd love to have more demand. And a good way to unclog that demand is to make it easier for people to get. Any additional questions or second questions from folks? Thank you all. I wish everybody a happy Thanksgiving. Get boosted now, get protected, and feel free to get tested before Thanksgiving, before you're around your elderly relatives and family, for that extra degree of confidence and protection that it can provide. Take care.